Today's report outlines a bold framework to improve children's health through 128 targeted directives and strategies.
We need to save the children. A lot of these 128 recommendations are things that I've been dreaming about my whole life.
That's the HHS Secretary, RFK Jr., pushing to make America's children healthy again. His MAHA Commission releasing a new report that outlines a strategy aimed at tackling an epidemic of childhood chronic disease. How are we going to do that? Good question for Kelly Means, Senior White House Advisor on the Modernizing Access to Health Act, and good morning to you. A couple things like top line notes here, all right? Put it up, folks. Number one, poor diet, chemical exposure, lack of physical activity and chronic stress, and over-medicalization. Okay, that's a lot, Callie. You want to summarize?
Well, I think along those core principles, President Trump and Secretary Kennedy have awakened Americans that there's a real problem for our children. Historic action was taken. This commission was the first time in history that folks from around the government, the USDA, the EPA, economic departments, military departments, and HHS, all got in a room together and figured out solutions to address the root cause of childhood disease. And Bill, this report yesterday, the actions from this administration are extraordinary. It represents the most significant reforms to our public health system in modern American history. And just listing a few, we're removing chemicals from our food. We're figuring out a definition finally for ultra-processed food. We're requiring nutrition education in med school. We're reforming the dietary guidelines. We're reforming front and pack food labeling to give Americans more transparency, unleashing innovation on farms to improve soil health. We're improving food in schools and military. The food in our schools and military is a disaster. We're going to have great new nutrition guidelines, which have been under the thumb of corporate capture for far too long. And we're very excited about an action right from this report. The president signed a memorandum on direct-to-consumer farm advertising. Okay,
it all sounds good, but really you got to do a deep dive to help define it. And whether you're a parent or whether you're just an individual watching you talk about this, you have to go and study this stuff for yourself, unless you're putting pressure on the food producers. Are you doing that?
Yeah, so I think there's an awakening right now, and you're seeing more public health messaging from the Trump administration in American history. But what comes through in this report is that we think Americans want to be healthy. We think everyone watching this channel right now wants to be metabolically healthy. They want their kids to be healthy, but they've been under pressure from incentives. We have a food system that's recommending and incentivizing bad food through our dietary guidelines from the Biden administration that recommend added sugar for 2-year-olds, and through our incentives like SNAP, which actually the majority of that goes to soda. We're taking soda and candy off of SNAP. The nutrition guidelines, the former ones, they go into school food procurement, military food procurement. You know, with our healthcare system, we talk in the report about Medicare and Medicaid quality metrics, not just going for whether you take your pills, which they do now, but actually go to whether that patient's getting healthier, whether that patient's eating better food, exercising. What this report does, and it's historic, is it goes to the incentives. We spend $5 trillion on sick care right now, really incentivizing and managing disease, and we spend hundreds of billions of dollars as a government to really incentivize ultra-processed food.
Yeah, Kelly,
that's what this report goes
let me
after.
just jump in there. Just two more things I got to get to, and I'm running out of time here. Look, I appreciate the energy you're bringing to this, the enthusiasm, but I need to learn it for me, like as an American consumer, so that I can take care of myself. And I'm just one of 300 million of us out there. Hear what Democrats are saying based on that hearing from just this week.
Nearly everything they have done makes Americans less safe and less healthy.
Over the past 7 months, we've witnessed a concerning and dramatic shift in public health policy under the leadership of RFK Jr.
I believe many of us would contend that the greatest threat to public health in the United States today is not a virus. It is not a chronic disease, but in fact, the leadership of Secretary Robert F. Kennedy Jr.
Okay, I want you to respond to all that. That hearing was a little more tame than the one from a week ago. Go ahead.
It's disgraceful. When you're questioning about public health messaging, Bill, there's a clear message coming from this administration, which is that we need to get to the root cause. We need to eat whole food. We need to celebrate whole food. I just saw a report recently that snacking is plummeting in America and people are eating more whole food. To those Democrats and to anyone questioning Secretary Kennedy and President Trump's agenda, which is extraordinarily popular, I will say, Chronic disease, particularly among children, will decrease by the end of the Trump presidency. We are seeing an unleashing of innovation, and we are seeing an awakening among Americans. Moms, inspired by the MAHA effort, are going to schools, demanding more local food. People are doing that in hospitals. We are seeing that awakening, and I'll bet any of those Democrats, what are your metrics? Our metric is lowering the devastating rates of childhood chronic disease, and we are going to do that in this administration.
Okay, there's an executive order set to be signed, right? They're going to go after pharmaceutical ads. How's that going to work, and how will that help?
President Trump signed it last night. This is the boldest action on pharmaceutical ads in history. We believe pharmaceutical ads are a public health crisis that mislead consumers, that wreck the doctor-patient relationship, that had led to overprescription. We're going back to 1997. Pharma inserted a loophole that made risk disclosures basically able to be put in a website, that you didn't have to educate patients on full risk disclosures. Pharma ads exploded since then. We're closing that loophole, and the FDA just sent out 100 regulatory letters
I understand there are 2 countries in the world who did that. Well, did that, us and New Zealand. So we'll see if that's significant too. Callie, please come back. It is a deep and thick topic. We want to learn more, and you got 3.5 years to prove yourself right. We'll see how it goes. Thank you for your time today.
Thanks, Bill. We're pushing.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.